Hello, and welcome to the AMA's Steps Forward podcast series. We'll hear from healthcare leaders nationwide about real-world solutions to the challenges that practices are confronting today. Solutions that help put the joy back into medicine. AMA's Steps Forward program is open access and free to all at stepsforward.org.
Hello, welcome to this episode of the AMA's Steps Forward podcast. This is Dr. Kevin Hopkins, and I'll be your host. I'm a family medicine physician and primary care institute vice chief at Cleveland Clinic. I also have the privilege of serving as a senior physician advisor for professional satisfaction and practice sustainability here at the AMA. On today's podcast episode, I'm joined by our guest, Dr. Michael Foti. Dr. Foti is an internist, clinical assistant professor of internal medicine, and the standardized patient program coordinator at the Touro College of Osteopathic Medicine in Middletown, New York. Dr. Foti, thank you so much for being willing to share your story with me and with our listeners.
Thank you for having me.
Our discussion today will give our listeners the opportunity to hear your compelling personal story of stress, loss, burnout, mental health challenges, and recovery, as well as a conversation about how medical educators can help improve the culture of wellness for learners. But before we dive into the deep end of this pool, Michael, do you mind starting by telling our listeners a little bit about yourself and your background?
Yeah, of course. I'm originally from the Bronx, New York. Went most of my schooling in Westchester County, New York. I trained in internal medicine residency program in Greenwich, Connecticut at Greenwich Hospital, which is part of Yale New Haven Health. I've worked in academic medicine. I've worked in primary care. And most recently, as you mentioned, I'm now the clinical assistant professor of internal medicine at the Touro College of Osteopathic Medicine here in Middletown, New York, in addition to being the standardized patient program coordinator for our simulation center as well.
All right. So you're a practicing clinician, you do education of medical students, and you have organizational role. Tell me about how you got your start. So you graduated from medical school in 2019, is that right?
May of 2019, graduated from the New York Institute of Technology, College of Osteopathic Medicine.
What was the start of your intern year like?
Yeah, I can imagine probably like most other interns, it was a big challenge. It's probably one of the biggest transitions in your medical journey, I think, going from being a medical student to being an intern and being responsible for patients. I had a particularly challenging time given my first rotation. Day one was in our intensive care unit. So that was definitely a big challenge, definitely a big transition, from being a medical student to being in an ICU. I just remember learning so much in such a short amount of time on the job, from my learning from my patients, learning from my attendings, and, initially very stressful, but I truly did love every day because I learned so much.
Awesome. So you're making that transition into your intern year. Things are going along, and then 2020 hits, the calendar turns, and some things start to happen, right? And we start to see people getting sick with a virus that we're just hearing about, starting to learn about, of course, the beginning of the COVID-19 pandemic. And that really becomes an issue that has to be dealt with and faced head on during the middle or tail end of your intern year in the spring of 2020. Can you describe for our listeners what that experience was like for you?
Yes. So towards the second half of my intern year, as we all know, March 2020 was when COVID-19 kind of arrived at our shores here in the U.S. We started to see more and more patients getting admitted with COVID-19 day by day. And eventually, so many of our patients in the hospital were admitted with COVID-19 that we had to restructure our entire resident team format. So we went to having 2 COVID teams and 1 team that was admitting patients without COVID. And even that team eventually was dissolved because eventually we weren't admitting anyone except for COVID-19 once April 2020 arrived. I myself was on the first COVID team, which was responsible for responding to all RRTs or rapid response teams, which basically, if for our viewers who may not know, respond to patients who have a change in their clinical status. And at that time with COVID-19, it was the change in clinical status was a decrease in their oxygen levels. And, to give some context, pre-COVID, and probably now again, on average, we'd have maybe one or two RRTs a day. But at the height of COVID at that time in April 2020, we were having an RRT every hour, if not more so. So this was 12 to 16 hours a day, every day that we were seeing this.
Wow. In RRT, you're talking about rapid response team. So basically code situation is what you're talking about?
Yeah, yeah. Anything but an actual, what we call code blue, where, which is oftentimes a cardiac arrest. So everything else besides that. So again, at that time, it was, usually a patient desatting and their oxygen levels were dropping. We would have to rush into the room, determine how much oxygen they were on. Is there any more oxygen we can give them without actually having to send them to the ICU to be intubated and placed on a mechanical ventilator? These were decisions we were making every hour, if not more frequently than that, and having to call family members to update them on that.
Yeah, this is a situation that probably even when it was happening, most of us weren't fully aware of, and maybe even haven't even thought about since. Like I'm just imagining, you're in your intern year of residency training, you're still trying to learn and figure out how to be a doctor, and then in the midst of this, as your first year resident, you and your team are having to learn how to take care of these severely acutely ill patients who have a tendency to decompensate very quickly, and it's a new infectious disease that we've not seen before. I mean, I can just imagine the stress level that would be associated with that.
Yeah, yeah. I mean, it was multifactorial, right? So, it was kind of, this is a new disease that we were all learning for the first time. I can remember very vividly being in meetings where our infectious disease doctors and our intensivists were discussing treatment algorithms. What's the current treatment algorithm? These are things that we don't even use for COVID anymore. And how are we going to treat this, right? We were giving multiple medications based off of other diseases such as Ebola that try to treat this disease. And for an intern who's still learning internal medicine and having to learn a new disease on the fly, and as much chaos as COVID pandemic was at the time. And then secondarily, just more the heightened urgency of the everyday life in the hospital, right? So it was this, chaos of RT every half hour to every hour, and having to be on alert at all times, and the emotional and mental aspect of it for sure.
One of the things that our medical education system and training hasn't historically done all that well is preparing us as physicians while we're learners for the emotional things that we'll experience in caring for patients. Did you feel like you were adequately educated, trained to get ready and to prepare you for this obviously unprecedented set of circumstances?
No, but it's as you mentioned, this was unprecedented, the worst pandemic we've had in 100 years. So, not that I can really blame, that my program or any program across the country that probably had interns who weren't ready for this as well. The things that I saw, I didn't think I would see in a million years. There were people in their 30s and their 40s who were suffering at an age when they shouldn't be suffering and when they shouldn't be tied to a bed, tied to a room. I was calling their loved ones to tell them that they love them because they were too short of breath to do it themselves. Holding my patients' hands as they passed away because their family members couldn't be in the room with them. And I lost so many patients at ages when they shouldn't be suffering and they shouldn't be passing away and leaving their families to ask why, right? So it was so much for especially someone in their first year of training to have to witness, to have to cope with. I just don't think that it was something that I was really processing at the time.
What effects did that have on you? Both immediately and lasting effects.
Unfortunately, not too long after all of this, I lost my mother at the age of 54. She died relatively suddenly due to what we found out to be complications from stage 4 lung cancer. And I, attended her funeral services, and only days later had to return to work because obviously we were still in the thick of COVID. So I don't even think I was able to fully grieve her loss at that time. And, I think I'm probably still grieving it to this day, to kind of compound on what was going on at the time.
Oh, Michael, I'm so sorry to hear about that. I mean, it sounds like this had to be one of the most challenging, difficult times of your life. Just sort of one tragedy on top of another. And I'm sorry for what you've had to go through. That's really a lot, and something that we are typically not well equipped for. Did you make it through this time, relatively unscathed, or what happened?
Yeah, it's again, it was kind of, I think, a duty and obligation that called me back, and I think adrenaline kind of got me through the rest of it. But unfortunately, when you don't process a lot of these emotions, it does have a detrimental effect, was what I learned. Because eventually, I graduated residency, and I started as an attending, and I had hoped to start a new chapter. But unfortunately, that hope quickly withered away. Every morning, once I was starting as an attending, I was having a fluttering sensation in my chest of this is intense anxiety. I was doubting every medical decision that just months before I was making. And I was waking up every night with intense panic, as if someone was tearing open my chest and squeezing my left arm off. And this was every night. And then again, every morning with anxiety. It was just so extremely intense. And months passed, and I really blamed the job at the time. And so I switched jobs, and they just eventually I got to my low point where, the anxiety continued. I would leave work early. I had my colleagues covering to see my patients because I just thought I was sick, and the anxiety only continued. And I thought to myself, I had this intense shame, like what I had spent so many years to become a doctor, as if I couldn't perform, and I was embarrassed to be me. It was truly terrible, and I shuttered away from my wife and my son, and stayed in my basement day in and day out. I didn't know what to do. And then unfortunately kind of boiled over one night in December, where the chest pain from this, what I thought was panic, was so intense it did not remit. I had my wife take me to the emergency room. You can imagine everything was negative, and so I requested to see a psychiatrist in the emergency room, and I was later diagnosed with anxiety and depression, and that was truly, truly my lowest point, where I said I don't know how I got here, and I just felt such a shame to be me. And I think that kind of plays a part into the stigma that exists in mental health, is why I felt that shame.
Yeah, we often feel as physicians, especially, that we should be able to handle and manage anything, and truly, people that go into careers in healthcare, and specifically physicians, tend to be more resilient than the general population. We're high performers, we're overachievers, we work hard, keep the nose to the grindstone. And certainly when I was training 20 years ago, that was sort of the attitude of, don't complain, keep your head down, just get through this. If it doesn't kill you, it'll make you stronger. But it turns out this type of situation can actually kill you. As you were talking about your physical symptoms, I'm just reminded of the it gives us a better appreciation for what some of our patients go through around the physical manifestations and symptoms of emotional distress, mental health challenges, anxiety, depression. Because I mean, it sounds like you felt like you were in trouble from a medical standpoint, even though the physical symptoms you were feeling were a manifestation of what was going on inside your mind.
Oh, 100%. It was some of the worst physical symptoms that I had ever experienced. I've had panic and anxiety before in the past before that, but I never had those physical manifestations of it, where it literally felt like someone was tearing open my chest and squeezing my arm off. It's an unbearable feeling, and I sympathize with anyone who's experienced it. It's something that you want to stop, and at that point it wouldn't. And I told myself, if not for me, but for my son and my wife, I needed to seek help, because I couldn't, shudder away from them anymore, and I couldn't continue to deal with that panic. And I did seek help, and I saw my primary care physician. He started me on an antidepressant. He referred me to a psychologist, and I saw my psychologist every week. Put in tireless hours of work on myself. And interestingly enough, I learned that the reason that I had developed the shame, apart from the fact of the stigma that exists, and I'll get into that, but another part of it too that I learned about myself is I had paired my identity, who I was, with being a doctor. So when that came into question, so did my being, my very essence of who I was came into question. And I think that's what truly shattered me. And that's when I really learned about myself. So that's why I tend to tell my students and tell my fellow colleagues, this is what we do. It's not who we are. And it's very important to make that distinction, because if that ever comes into question for whatever reason, you will lose yourself, and then it's dangerous.
Yeah, absolutely. What you just said really resonates with me, and I use those same words pretty much. Like, a doctor is what I do. It's not who I am. My identity is far bigger than that, much different than that. In fact, when I meet people for the first time, I almost don't want them to know that I'm a doctor because of the invariable questions that ensue as a result of that. But yeah, if your identity is wrapped up in what you do as a profession, whether that's a physician, a lawyer, or anything else, it can be a dangerous and untenable situation. Did you have any concerns about seeking help? I know sometimes that's a challenge for physicians. They have concerns about, licensure, or, whatever it may be, if they admit that they're struggling with a mental health disorder, or even beyond that, substance abuse, those types of things. Did you have any hesitancy about getting help?
Yeah, of course. Like I'm sure many of my colleagues and many medical students do, so I took it upon myself to do research, and I learned that anxiety, like other mental health disorders, are protected under the ADA as a disability. And as a disability, you don't have to disclose that. So, at the time when I was trying to figure out my job situation, that's something that I did learn. And so I wanted to be sure of that. But I actually came to a point where I did disclose about my anxiety and panic and my depression with my job at the time, because I said to myself, you know what? I want to be transparent. And also, I'm not ashamed of what I'm going through. As I healed more and more, I learned that, and I tell this so many times. I've said it in talks before to my university and to others. It's important to understand that doctors, medical students, any healthcare professional, we are human beings just as much as anyone else is a human being. So we experience suffering, we experience loss, we grieve just like any other human being, and can experience the effects of that, the subsequent effects being such as anxiety and depression, just like any other human. It's part of the human experience to have this occur. And so that's what really helped me relinquish a lot of the shame. And that's what I want to speak to, this stigma among healthcare professionals and mental health. The stigma exists because it's seen as a weakness to be a healthcare professional, to be suffering from anxiety or depression or any mental health disorder. But it's not a weakness. It's literally a part of the human experience. We suffer, we lose people, we grieve, and we can develop anxiety, depression because of it. Especially for healthcare professionals who see so much suffering on a daily basis in their jobs, apart from their lives, and in addition to. So we have to remember we are just as much humans as anyone else. It is not a weakness, and rather it is the strongest thing you will do to get the help that you need.
Right. And we explain it to our patients all the time, right, that are struggling with these types of things. Sort of the analogy of being on an airplane: put on your own oxygen mask first. You got to take care of yourself before you can be of any good to anybody else. And yet, often for us as physicians, we feel like that doesn't apply to us. Mike, you're passionate about raising awareness of the importance of mental health among healthcare workers, and resolving that stigma that you mentioned that's often associated with it. And I'm thankful that there are people like you and others in medicine that are willing to stand up and say, we've got to deal with this and address it in a different way. Often when you want to change something, a great place to start is to go upstream. So what role do you think medical education and medical educators play in ending this stigma?
Great question. And really it's speaking up, right? So now I've already spoken up at my institution here at Touro College of Osteopathic Medicine. I shared my story with my students, and one of the main things that many of my students say to me was to be able to hear from someone who they soon wish to be in their shoes, right? A physician who they look up to, sharing that they too have dealt with something like this, whether it be anxiety or depression, that they can relate to this person and also see that there is, light at the end of the tunnel, that you can get through this and be in a position such as myself, being so happy to be here and teach such amazing medical students, right? That is how we as medical educators can help our students. It's a scary statistic that about 30% of medical students across the nation are suffering from anxiety and depression, and they're not seeking help because of the stigma. So we as medical educators, whether we have those personal experiences or not, need to be able to speak up, especially if you do, and tell our medical students, hey, this is a normal part of the experience. but make sure you get the help that you need, because medical school is one of the toughest parts of the journey. So it's the more and more we speak up, the more and more our students that come through medical school will be able to relate and not be afraid to get the help that they need.
Yeah, fantastic. And I know you've developed what you've called Cafe Foti, which is I think a weekly sessions where medical students can come to your office for free coffee and snacks, which that alone would get me there, probably free coffee and snacks, but also to have conversations about the things that matter to them. I just think that's so cool. What is this forum, and even just your willingness to be available, how does that affect your relationships with your students?
Yeah, I speak about it often. It was the idea was born out of the fact that, as I've continued to work in medical education, I know what the students are going through because I was a medical student not too long ago, and I understand what they're going through. It's the most difficult part of the journey, in my opinion, of this medical journey. Becoming a doctor is medical school, and so I believe now, having gone through the toughest parts of the journey, now being able to be in the position that I am, if we're expecting our medical students to go above and beyond, to go through this most difficult training that you could potentially go through, to become physicians and sacrifice their time and their lives for the betterment of their patients, the least that I can do, and I think all medical educators can do, is go above and beyond for them, right? Outside of the classroom. Obviously, we do much in terms of curriculum and teaching inside the classroom, but I'm talking about spending those hours outside of the classroom for our students, because that's where really I think the true learning lies, where you get that extra conversation, that extra review of topics. I come in early, I stay late. I've had sessions on Fridays and on weekends for my students because they need it. And if they need it, I'm there for them, right? So the idea of Cafe Foti was kind of born out of that, where I said, if I can create a safe space for students to come to my office, have a free cup of coffee, have some snacks, just talk, mentor them on their career, mentor them on really anything, or just review topics that they're going through. And honestly, it's blossomed. I have students in my office anytime I'm sitting in here, and they always come in, whether just to grab a snack. There are many students sitting in my office and drinking a cup of coffee. We talk about anything. And so much so that when the holidays came around, a group of first year medical students got me a sign for my wall that says Cafe Foti, lights up in all different colors as I choose from this remote here. And, they've really fallen in love with Cafe Foti.
Awesome. I love it. It's so cool. What do you hear from your students specifically about mental health and burnout? Are they concerned about it? Are they struggling with it? Do you think now more than ever, or is it better? Do they have concerns about what it's going to be like when they get out of med school and residency training and are attending, as we talk about the epidemic of burnout in healthcare that really preceded the pandemic, and we're still fighting it now? Do they have concerns about it?
Yes, of course. I mean, they ask me, a lot of students, and it's interesting. I don't know if this is a shift in medicine, but so many students are actually coming to me and saying, yes, I'm interested in this specialty, but I'm concerned about the work-life balance. I don't want to burn out, right? It probably is a shift. Right, because physician burnout is so prominent now. And, we've obviously addressed it with the residency hours, but I can tell you that's still not enough. Having been a resident in the new residency hours, I think we still have ways to go with that. But as I tell my students, make sure you go into something that you truly enjoy. You're going to be spending so many hours doing it. Really make sure you love the medicine of it. And also remember why you're here. Always constantly remind yourself of that. And then I also tell them, and I think this is something too in a shift in medicine, is remember, with this degree, you can always pivot, right? If you want to. Don't become a cog in the wheel. Remember that you can always shift into things such as academia, such as I did, or you can shift into entrepreneurial pursuits or business and whatever have you. Always follow your passion. Don't think you're stuck in this path. So I constantly remind them to make sure that they're happy with whatever they're doing, or really it's not worth doing it.
Yeah, that's terrific advice, and very sound for all of us to listen to and to heed. Because if you're miserable in your job and what you do every day, especially if you let it define you as a big part of your identity, then it's going to color your outlook on the entirety of the rest of your life. Are there any other practical tips or pearls of wisdom that you might have that you want to make sure you share, Michael, that we haven't addressed yet, particularly for medical educators who may want to continue to make an impact on the evolving culture of medicine?
Yeah, no, for sure. I think that beyond just being there for our students, and I think there needs to be a large curricular shift in medicine as well. I think we add a lot of stress to our students. This comes from conversations with my students, right? So they oftentimes, although I do think our institution does a great job of this, but oftentimes I'm sure students here and everywhere across the country kind of feel locked in terms of their expectations of how they're supposed to study, what resources they're supposed to use. They kind of get lost in all the resources that we provide them. But one thing that I do really love that we do here at Touro College of Osteopathic Medicine is this flipped classroom approach and self-directed learning, where we allow the students to be engaged in the class, and then outside of that, use resources that they find most useful for them. I do wholeheartedly believe that every student learns differently. I myself learned in a problem-based learning curriculum. And so I think we can alleviate a lot of the stress and angst across the country if we really clench our teeth into this self-directed learning, allow our students to decide how they want to learn. As long as they're excelling and doing well in their exams and learning what they need to learn, let's take the stress out of that, provide them with evidence-based resources, and allow them to learn in the best way that they deem successful for them.
Yes, thank you so much. Really appreciate that. Dr. Michael Foti of Touro College of Osteopathic Medicine in Middletown, New York, has been our guest for this episode of the AMA's Steps Forward podcast. Dr. Foti, I really just want to thank you so much for joining us today. Your willingness to be transparent and vulnerable in sharing your personal journey and our discussion of opportunities to improve the culture of medicine from the ground up has really been an encouragement to me, and I'm sure it will be to many more. So thank you for joining us.
Thank you. Really, thank you for giving me this platform to speak and share my story. And, I really appreciate your podcast. Thank you so much.
Thank you for listening to this episode from the AMA's Steps Forward podcast series. AMA's Steps Forward program is open access and free to all at stepsforward.org. Steps Forward can help put the joy back into medicine by offering real-world solutions to the challenges that your practice is confronting today. We look forward to you joining us next time on the AMA's Steps Forward podcast series. stepsforward.org.